We'll start in just a moment. We'll wait till we get a few more people on the line. There's like all kinds of media carrier there. Good morning. My name is John Hager, Executive Director for the Silver State Health Insurance Exchange. Welcome to the April 10th SHOP Exchange Carrier Onboarding discussion. Today we're talking about, enrollment payments for SHOP. We have Chad Hogan here from the Choice Xerox team, and he'll be leading us through the presentation. The presentation was posted on our website last week. We've received several questions from a couple of carriers, and we will go through those when we get to the end of the presentation. Additionally, we've also received we've updated our April 3rd presentation based on concerns from last week. We talked about concerns about having a 5-day notice period for non-APTC folks. We've eliminated that 5-day period, so please take another look at that. Additionally, CMS and CSIO have announced yesterday approval of the rating areas as proposed by the state. So the difference from previously provided is that the Clark County, Nye County area will be combined, and that includes Pahrump and Tonopah into the Clark County area. So you can take out the Nye County area out of the rural areas that was previously proposed, and so then the remaining service areas remain the same as proposed. So the difference again is Nye County will no longer be part of the rural area, but it'll be part of the Southern Nevada Clark County rating area. And we will update our presentations to show that, so that you can. We don't have any confusing information out. Well, we've got lots of confusing information out there. One less piece of confusing information. So again, rating areas have been approved. They are posted, I think, on the CSIO website, and we will update our presentations as appropriate. So with that, I'd like to turn it over to Chad so he can start with the presentation.
Thank you, John. Good morning, everyone. Thank you for joining us, either here in person or on the phone. As John mentioned, the focus of today's carrier onboarding session will be specifically focused for enrollment payment information for the SHOP exchange. Specifically, we'll be looking at, if you're following along on the PowerPoint deck, page 3, we're going through our objectives. We'll be looking at new group enrollment management, membership management, financial management, and then, as always, wrapping up with some questions to issuers, or answers to issuers submitted questions. So, my name is Chad Hogan, and along with me I have Steve Wynn, who will be going through and walking through the questions with you today. All right, moving on to slides 4 and 5, new group enrollment management. So in looking at the SHOP new group enrollment, the initial open enrollment coverage period will begin October 1st, 2013, with the first effective date of coverage beginning January 1st of 2014. Unlike on the individual side, where there is an annual open enrollment period, the qualified employer may purchase coverage for its small group at any point in time during the year, should they meet participation and eligibility requirements. The employer's plan year is a 12-month period beginning with the qualified employer's effective date of coverage. One of the fourth bullet on slide 5, we're going to talk a little bit more later on, which is in regards to a purchasing model. As many of you are probably aware, the Exchange Board has established various purchasing models for employers. A purchasing model is in essence a way for an employer to choose a grouping of plans that are offered to the employees, and yet still offer an employee choice model where the employee ultimately elects the specific QHP that they are wishing to enroll in. And we'll cover more. There's 4 specific scenarios later. But one of the key items is that the employer must select that purchasing model at least 60 days prior to the requested effective date of coverage, and that's to allow timing for the open enrollment windows for those employees. Employees will be provided 30 days to select the QHP options that were offered by the employer's selected purchasing model and complete the application process. And then in addition, the employer's enrollment and initial payment to the exchange must occur at least 15 days prior to the effective date of coverage. Any questions in regards to that before I call out the comment on the proposed reg? All right, very good. So there is a proposed regulation for employers that do not meet participation or contribution requirements during the year that they'll be eligible for an annual special enrollment period between November 15th and December 15th for a 1/1 effective date starting in January 2015. That's not an allowance that will be available for this first open enrollment period if the proposed rule is made final. However, it would apply to subsequent enrollment periods, the first one being for January 2015 effective dates.
And one thing to add regarding the participation rates and contribution rates, the board originally approved a proposal to allow for package plans. If you recall, carriers can they have to submit plans as open metal plans. Every plan that you open in the I'm just talking about Shop Exchange. Every plan that you offer in the Shop Exchange has to be available on an open metal tier basis. You can also designate those plans to be either an open metal or an open shop plan or a package plan or both. Under the open metal and open shop plans, because there would be multiple carriers available for an individual employee. So an employer picks multiple carriers, basically with open metal tier or open shop. We had to standardize contribution participation rates at 50% and 75%. We, at the time, I think this was last summer, decided that we wanted to provide carriers with an option that was most like today as possible, and so that if you provided a package plan that was basically just one of your plans or 3 of your plans, whatever number of plans you have in that package, that you could set your own participation and contribution rates. We've realized that is too difficult to administer, so we have a proposal going before the board tomorrow that will discuss standardizing that so that for the package plans, the minimum contribution rate would be 50% and the minimum participation rate would be 75%. So this doesn't change that rate for the open metal tier, and it's the same plan that would be offered on the package plan, but you can't adjust your participation and contribution rates on the package side. We've just realized it'd be too difficult to administer, so we're going to standardize that. We're going to try to. We'll see what the board says tomorrow. That said, the 50% is a minimum participation contribution rate based. It's the minimum contribution rate on the lowest plan that's available to the employees, the non-smoking rate, and the employers. Athena. And employers have the option of increasing that percent contribution to a higher amount, to including contributions for dependents, and including, we call out separately domestic partners because the Domestic Partnership Act here in Nevada says that employers are not required to provide benefits to domestic partners in the same manner as spouses, so we call them out separately. And so we give the employer the ability to contribute more than the 50% minimum, but they can't contribute less. The 75% participation rate, I think Chad will go over in just a second. Are we on the next page?
Yeah. So John kind of jumped here to page 6. We're going to talk a little bit about shop eligibility. So we're going to walk through this in a couple different ways, the first being the employer, the employee, and then the dependent, and looking at those rules around eligibility. So the SHOP eligibility for an employer is defined as 1 to 50 eligible full-time employees minimum. The principal business address of the employer must be within the Nevada Exchange service area or the employee's primary work site in the service area. There is, as John mentioned, a minimum 75% participation based upon eligible employees, and those are eligible employees who do not have other minimum essential coverage. So if there's employees that are offered other minimum essential coverage, that does not count towards participation requirements. In addition, there is a minimum of a 50% contribution by the employer towards the lowest cost plan available to the employee. So out of that plan package, there'll be a series of, in that purchasing model, there'll be a series of plans offered in those various packages. It's 50% of the plan, the least cost plan to that employee, understanding that not all plans will be available to all employees in all service areas. If you go with an open tier or an open shop concept, not all employees will have eligibility for all plans. As such, the contribution isn't fixed. It's based upon the lowest cost plan available to the employee when they go to enroll.
So as an example, if an employer chose a gold medal tier, then only gold plans would be available to employees. And so whatever the cheapest gold plan, take 50% of that cost. And that's what the contribution rate would be. The minimum contribution rate would be for the employer. So if the employer wanted to, say, hey, that's too expensive for me, I need to provide a cheaper plan, I can't provide that much, go to a silver or a bronze medal tier and do it that way. Or offer, as Chad mentioned, the package plan that offers a gold or a bronze plan side by side with a gold plan, or however you guys designate those packages to be.
All right. Excellent. All right, so eligibility from the employee standpoint. The employee must receive an offer of coverage from a qualified employer, and they must be an eligible employee as defined by the employer. A key point to call out there is that the employer is determining who they are defining as an eligible employee. Full-time employees are defined as 30 hours or more. Employers can choose to offer coverage beyond the minimum requirement for full-time employees. If you have an employee who is being added and it's to a new group, a group that's not currently covered through the exchange, the employee must be hired before the group's effective date of coverage. If not, then the individual must complete the group's waiting period before coming on as a new hire, or be eligible for a special enrollment event. So if you have an employee who comes on during the employer's initial open enrollment period, they would be eligible to be added even if they do not meet the waiting period requirement, because the group's coverage has not yet become effective. After it is effective, it's going to follow a typical new hire procedure where they would need to satisfy the group's waiting period prior to becoming eligible. Eligibility for dependents. Dependents have been defined as a spouse, children who are born to, adopted by, or legal guardianship of, and those are ages 0 through 25. Dependents who are disabled, and they must be declared disabled by SSA prior to enrollment and submit proof of disabled status to be eligible to be continued as a disabled dependent. And as John mentioned, due to state requirements, domestic partner is at the option of the employer if they wish to cover that as a dependent.
Pending the outcome of the Supreme Court decision that will be the next couple months. So, as the law is right now, it's an option.
Any questions on slide 6, general SHOP eligibility for employer, employee independence, before we proceed on to tribal SHOP eligibility?
Yeah.
I have a question about the employer address. Is it possible that employer is outside of the service area? Then how do you rate it?
So yes, the employer's primary address can be outside of the service area, in which they would need to designate their group as a work site group, meaning that the eligibility will be based upon the employee's primary work site being within the service area.
So, for instance, you could have an employer's primary address in South Lake Tahoe, California, but there is a work site. They have multiple work sites, and one of the work sites, Reno, Nevada. The employees that work at the Reno, Nevada work site would have eligibility for the Nevada exchange. The employees that work at the the South Lake Tahoe work site would not be eligible for the Nevada exchange. They'd have to go to California.
Yeah, and the employer needs to declare.
Then your 75 participation is counted by state or by group?
It's based upon, so the employer will declare whether they are a principal business address in the service area or they're using worksite rule. And for participation, if it's declared by worksite, it would be by the number of employees who are eligible within the Nevada Exchange service area. So if there are, use the same example John had, if there are 30 employees in South Lake Tahoe and 10 in Reno, it would be based upon the 10 employees in Reno needing to hit the 75% participation requirement. 8 people.
Thank you.
I have a question on participation. Does that apply to dental and medical plans, or just medical?
That's a good question.
That's a very good question.
Can you please send us an email with your contact information, and we can discuss that offline?
Sure, thank you.
We are going to have a carrier email address set up soon, but we don't have it yet, so I'm not going to give an email address until we get that set up. For right now, can you please send that to Damon Haycock, DHAYCOCK at exchange.nv.gov, and he'll contact you, and we'll try to come up with a reasonable solution.
Which issuer was that? That's the question?
That's all right. They can.
If an employer wanted to,
Go ahead.
if an employer wanted to extend benefits, say, to people who only work 20 hours a week, would they be able to do that at a lower contribution rate, since that's outside the other rules, the required rules?
So the decision that has currently been made is that the minimum hours worked needs to be 30. So they couldn't have
Oh, I
that.
thought he said they could extend it beyond that if they wanted, at the employer's choice.
It can be extended, but it would be at the same participation level.
And the same contribution level.
Well, the same contribution level.
Okay.
And from a group side, it would have to be at the same contribution level.
Well, and they would be including the participation rate.
Yes.
We have to look at the regulations about what can be allowed, though. I think that we had a discussion about it, and I don't think we've solidified that. But there are certain regulations in certain federal regulations that will allow or disallow that. We'll double check that and get back to the group. Can you put that down as a for action
of FTE issue?
It's.
Would you add them all up as FTEs?
You have to
participation, or do you?
Yeah.
Well,
count them as belly buttons?
Right. So there's the participation side, but then there's also the who is eligible side, and you have to look at 4 or 5 different paragraphs to kind of put it all together. So we'll take another look at that and provide a solid answer for you next week.
I have a question about the waiting period. Are waiting periods also decided by the employer?
Waiting periods are defined by the employer.
But they're no longer than 90 days.
30, 60, or 90 days, as defined by the employer.
The only time that there would be a change in that is if you're in the look-back period assessing if a person is going to be a full-time employee. And that's all defined through IRS 2012-57 in the Safe Harbor rules.
You're coming to all these meetings now.
I have a question. This is Lori from Health Plan of Nevada. If an employee works from her home in Reno for a Las Vegas employer, what is the employee's primary work site, and how does that relate to the service area rating?
So we've got a couple questions around this. I'm going to defer that towards the end when we actually talk about kind of some of the cross bridges of worksite rules, and you've got people in split service areas, and we have a fairly concise response, and I want to try and address all that at one time, if that's all right.
Sure, that's great.
Okay. All right, moving on to slide number 7. This will be shop eligibility for tribal membership, the American Indian Alaska Native verification.
Can I take this one?
Sure.
On this one, we've had some confusion in the past, and there's one little mistake on the slide. This is CJ Bowden with the Exchange. American Indian and Alaska Native have a little bit of special provisions related through the ACA, and one of those provisions transfers over to the shop exchange as well. And with that, if a person comes in and identifies that they are either an American Indian or an Alaskan, they must provide proof of that membership. Proof of that membership will come to the exchange.
For those that are on the phone, if you could please mute your phones until you have a question. Please mute your phones. Thank you.
They will provide proof of that to the exchange, and we will identify that person as a member of a federally recognized tribe. At that point, the individual has 90 days to provide proof. If they don't provide proof, then those special conditions will not apply. The special condition and the special right that Native Americans have is the changing QHPs once per month. I've talked with our federal partners, and in the shop exchange, cost sharing reduction, that is only for the individual exchange. If a tribal member enrolls in a QHP through the shop exchange through an employer, they still can change once per month, but there are no cost sharing reductions and there's no special eligibility period for that. They can come in and out on the employer's eligibility period or on a special event, but that is all.
Thanks, CJ. Can everyone just double check and make sure your phone's on mute? We're getting some background noise. Okay. Any questions on the tribal membership before we move on to slide 8?
Okay, this is Adrian, and we just want to validate that for tribal membership, on slide 7, is it applied to small group or is it only meant for individual?
Okay, the tribal membership is applied to small group only in the matter of can change QHPs once per month. But if they change a QHP, they are still on the waiting period that apply to those changes of QHPs. So they can't just change on the 15th of the month and they'll be in the new QHP on the 1st of the following month. If they apply between the 1st and the 15th, they will hit the 1st of the following month. If they apply for a change between the 16th and 31st, they will go to the 1st of the second following month. So those rules still apply, but there's no cost sharing reduction rule or special provision if they enroll in the shop exchange. They give up that provision if they're in through the shop exchange through an employer.
Okay, and so does the exchange have the responsibility for verifying tribal membership for changing qualified health plans?
Yes, the exchange will take care of all of the verification. They have 90 days to provide that verification, and if they don't provide it, they automatically lose the ability to change the plans once per month through the shop exchange, and the carrier will be notified.
Okay, awesome. Thank you. And if you reviewed that earlier, I was just having a hard time hearing because of that background noise, so thank you.
No, definitely.
We think that's hopefully sounds like it's been resolved, so hopefully we don't have that going forward. All right, moving on to slide 8 and 9. I'm going to talk about them collectively. Slide 9 is more specifically of a reference, kind of showing some examples of the purchasing model. But there are 4 purchasing models that were approved by the exchange board. The first being the open metal tier, and that is the one that is actually required per ACA, that any QHPs that are offered on the exchange in a given metal tier be offered to an employee to enroll.
And so there's one update to that. We are not changing anything, just to be clear. the federal regulation that came out recently, I can't remember exactly, March 11th, I think, indicated that the open metal tier option and the premium aggregation function of the exchange is optional for 2014, and that the federally facilitated exchange would not be doing that. They're simply going to put carriers in contact with an employer, offer one product, and then that's it. The exchange has planned on going with the open metal tier, and we will continue to go forward with the open metal tier and the premium aggregation functions. So we are not changing our course just because the feds have loosened this up. We think that this is an important product, an important part of the exchange for employers and employees. So we are not changing that. Just want to make sure everybody's clear on that. We've had lots of questions from lots of different people, including insurers, on how that goes. So again, we're going to keep going forward with the premium aggregation functions and the employer-employee choice models that we've already approved.
Thanks, John. The other model is Open Shop. And the Open Shop, the plans that are participating within the Open Shop can be designated by the issuers as Open Shop plans, or they can be designated in one of the other two models, which is a single carrier package or a carrier partnership package. The idea being with the one carrier, one package, that's if you're looking on slide 9, that's the upper right-hand option. And this is where you as an issuer would define a grouping of plans that could be offered in a particular package to an employer for their employees to choose from. The concept of the partnership package is where the issuers would partner together to offer plans, maybe to cover other service areas that may not be serviced by a single issuer, so that the employer could have a complete offering to their employers and spread the risk across service areas through a partnership package between multiple issuers. And again, it would be up to the issuers to define which plans are available and which carrier issuers they're partnering with in those packages. As John did mention, there is currently a recommendation before the board to standardize the participation and contribution requirements across all packages to be 50% minimum contribution and 75% participation requirement across all packages. We'll provide additional updates and information as we determine or receive the board's determination on that recommendation. So I'm just going to reiterate, all shop QHPs must be offered for sale in the open metal tier option. If you have a QHP that is approved as a gold QHP, it must be offered in that gold open metal tier option. You cannot exclude any QHPs from the open metal tier option. However, in an open shop or package or both, the issuer can define which products and which plans are offered in those purchasing models. So just to clarify a couple of terminology pieces, the four options that you see on slide 9, we are defining those as purchasing models. The actual grouping of the plans and what is made available to the employees and employer, those are packages. So just a couple of terminology there, because we will be asking the issuers to define packages. The purchasing models are what are defined by the exchange. So employers will select, during the enrollment process, the employer will select one of the purchasing options for their employees. If an employer chooses one of the package options, the employer will select a specific package. You may offer more than one packaging of plans. I believe we define that as you can offer up to 5 plan packages in each purchasing model. So that would obviously not apply to the open shop or to the open metal tier, but to the single carrier packages and the partnership packages. And so if the employer chooses, employer chooses the one of the package options, the employer will select a specific package for their employees, and those plans in those packages will be then available as options for the employees to choose coverage. So we have a little bit of both an employer choice and an employee choice model here so that there's some decisions made by the employer, and that the employee ultimately selects the coverage which is best determined by them to be applicable to their family.
I think a little bit of this would answer the question that we had previously on the phone as well with the partner package type. This would directly apply for businesses that are based in either Reno or Las Vegas and have employees in the other location. They could pick two different carriers to offer to their employees. So they have a carrier that services the southern area and they have a carrier that services the northern area. And there would be a restriction on employee choice by their zip code so that they wouldn't pick the plan that is in a different service area. So that's where those come in.
Yeah.
This is Adrian from Anthem. How will the carriers communicate the packages to the exchange?
So as part of the your ongoing or the onboarding engagement with the exchange, we will ask you to define your packages. That will be done after the QHPs have been certified by the DOI, so that you know your final set of options that you'll be working with. And from there, we will ask you to group your plans appropriately.
I imagine
it's from a communication mechanism. It's probably as simple as an Excel sheet, a template that we can provide and ask for the issuers to fill out.
And I imagine one plan could be offered in more than one.
Yeah, absolutely. There's no restriction in terms of QHPs being included or excluded in various packages. You can offer a plan at a minimum. It has to be in the open metal tier, but it could be offered in all four purchasing models. And there's no designation from a filing standpoint or anything that would indicate otherwise. It's at that point in time you're creating your packages from your approved QHPs.
Okay, and so you said after QHP filing. So is that most likely going to be a June activity?
We would like them sooner.
We would like them sooner, but yes.
Filing date is June 7th, final date for the Division of Insurance to submit QHP binders for their review. And so if you wait till June 6th at 11:59 p.m. to shoot it over, then the chances of them being able to approve those QHPs, it'll take them a little bit of time. And if you need that to happen, of course, before, it could be a July activity, depending on how late you wait to file.
Yeah.
Okay, great. So we can do this after our initial QHP filing, but ideally you would like to have it as soon as possible.
Right. If you know how you're going to package and offer your plans, we'd like to coordinate with you ahead of time on that, pending final certification of your QHPs. Okay. Any other questions on slide 8 and 9, the shop purchasing models? All right, hearing none, we'll move on. Slide 10, shop eligibility and enrollment inconsistencies. This is something that's specifically called out as a minimum essential function of an exchange. And so the exchange will be making a reasonable effort to identify and address the causes of inconsistencies. Inconsistencies could be things such as an employee claiming that they are a full-time employee and wanting coverage, and their employer saying no, they are not, and how we would work to resolve those. Those could be typographical, they could be clerical errors, but the exchange is the mediator to help resolve those type of eligibility and enrollment inconsistencies. The exchange will notify the employer and the employee of any inconsistencies that we are aware of, and we will provide the employer and the employee 30 days to resolve that inconsistency. If not resolved appropriately, and assuming that it is in a negative determination of eligibility, the exchange will notify the employer or the employee of that denial. If it does end, determine that it is a result of an ineligibility, termination coverage at the end of the month following in which the notification was sent to the employer. So it'll be a prospective termination of that. And then we would also notify the employer and employee of their right to appeal that eligibility determination. Any questions on slide 10? Okay. Moving on to slide 11, what this represents is a high-level overview flow of the new group enrollment management overview. As with previous flows presented in the past, we're not going to talk through each of the individual boxes, but if there are specific questions in regards to these, we'd be happy to answer them at this time.
Okay. Deepak, can you jump in with your two questions?
Yeah, I have one question, rather two questions. One is, when we are developing QHP package, is that like when the enrollment happens, will that have a package identification plus QHP identification? Or that's one question. And second is, when we are saying a package, that any subscriber from that small group, can they pick up any QHP out of that package, or how it happens?
So this is going back to the purchasing model and plan package question, correct? Section?
Yes.
Okay. So there is not a package identifier that will be transmitted to the issuer. You will merely be aware of that individual's selection of that plan for enrollment. Did that answer the question?
Yeah. So basically, then in that, as part of small group, if there are different subscribers, then each subscriber can pick up different QHP from that package?
Each subscriber and their dependents as a household will be able to select a QHP from that package, and they may be different from different issuers, or they may all be from the same issuer, depending upon the purchasing model selected by the employer.
Still zip code dependent.
The employee would still need to be eligible for that coverage based upon the plan service area. So again, but to use the example from earlier, you have a carrier partnership package, Northern Southern Nevada. You've got employees split in both locations. The employees in Southern Nevada would only see options to them for which they would be eligible from coverage from the Southern Nevada carrier. The employees in Northern Nevada would see the QHP offerings from the carrier in Northern Nevada and the QHPs that they have elected to have in that package. So eligibility for the employee is still determined based upon the employee's location, regardless of how many different QHPs are in the package. The employee still has to be eligible to choose that plan for enrollment.
Yeah, and one more question is, let's say if an employer is falling in certain area and there are different plans and there are two subscribers, and correct me if I'm wrong, that one subscriber can pick up one package from one or one QHP from one carrier, and other subscriber can pick up other QHP from other carrier. Is that correct?
That is correct. If the purchasing model elected by the employer permits that.
And the carrier permits that in their package submission.
So the case where that would...
And coming back to that 75% employees covered or not, so is it by, it's among all the carriers? Is that a
That's correct.
criteria or...
Yeah, it's 75% of total eligible employees for the group. One issuer may end up with, if we have 10 employees, one issuer may end up with 2, another issuer may end up with 4, and another issuer end up with 2. And they will have met the participation requirement for the group, although the participation on any given issuer has not met that threshold of 75%.
Thank you. That helps.
Are you going to have specific identifiers for the employer and subscribers assigned by exchange?
Each individual will have an exchange identifier that is transmitted as part of the 834 enrollment.
How about the group itself?
We are working through the group setup process with each from a logistical standpoint, as the 834-5010 standard does not permit transmission of group information. As part of that, we would be open to suggestions from the issuers regarding if you require the group to be set up and how you would like that information communicated.
What would be the purpose of knowing what group it is? I mean, if an employer chose, say, the open metal tier, you could get all of the people, all of his employees. You could get none of the employees. So is there a reason under this new model that it's necessary to have the group information?
I can imagine that the group is rated, might be rated by the group address, not by the employee address. That's one. And then industry code is specific to the group, and there are a couple of other number of eligible employees, and so on, so on. So some contact information or any other information group related.
So the exchange is managing membership and eligibility. How we have seen this implemented in the past is the issuers maintain a single instance of a risk pool or group setup, and members for the exchange come in and out of that group or risk pool that's been established by the issuer. There's not actually a group established on the issuer side, as all of that is managed and maintained by the exchange.
And because of the new rating rules, everybody is in the group market. Everybody is individually rated within the entire group, within your entire book of business. So there is no more group rating as far as employers go. And again, as Chad pointed out, as far as who's eligible for what plan, the exchange is managing that functionality.
Well, aren't we reporting the Medicare as a second payer to CMS when we have to report on the employer as well? Or is it the exchange functionality now?
That could be a separate reporting that we can send over to the carrier to report to CMS.
So it's the responsibility of the carrier to report. I'm trying to understand this. It's the responsibility of the carrier then to report that an individual is covered under a specific employer, or is it the responsibility?
Yes, because there are specific rules related to Medicare paying first or second, depending on the number of the employees for the group. It's less than 20, then Medicare is primary, and if it's greater than 20, it's Medicare is secondary. And then that number, less than 20, more than 20, is determined by the employer itself, certified. There is a procedure for that.
Right. So the tier of coverage, the age band, would be communicated as like a 65M, 65P, 65S, primary and secondary for Medicare payer, so that you can report out who the primary payer was on that 65-year-old from a premium standpoint. In addition, there's going to be a premium difference, obviously, for an employee who is Medicare primary than an employee who's Medicare secondary payer.
So just so that you're aware, that was my ignorance. Everybody else at the table was shaking their heads in agreement with you. So we can't know all the rules, although as a group we should here at the exchange. So are there any other reasons that we need to provide to you the employer information?
One of the things that you guys are doing, are you sending out the delinquency notices to the employer group?
Yes.
Because one of the things on the CMS file, I know the tax ID number of the group has to go, the size of the group, size of the employer, not what's in the exchange, but the size of the employer.
Yeah.
So the other side of that is that the feds are continually coming up with new rules, and it may not make sense for that rule to apply anymore. So perhaps we can get a reference. I mean, do you have a reference? Do you know what rule the reference to that rule, or do you guys have a reference to that rule so that we can send that to the feds and say, hey, this doesn't make sense anymore?
We can pull it up.
Yeah,
we have that.
Well, speaking for Ansem, the current system is set up to have a group information, and if we don't, then it will cause a significant hardship on the side. That's baseline.
Right. Well, which is why I made the comment that in in other exchange implementations that we've seen, the issuers maintain a single group record with members that come in and out of that single record. Because in essence, it's a single risk pool, it's a single group. You call the group Nevada Exchange in your system, and your members come in and out of that as transmitted by the exchange.
John, this is Kyle at United. On our end, we'll get back with you on this. We hadn't given it any thought because I believe I was on a call with the feds just about 3 weeks ago, and they specifically said that they are going to provide the group setup because they understand that the carriers have to track it. So we'll have to go back and find our notes. So we were just completely under the assumption that the state was going to follow the federal rules on all of this. So this is catching us a little off guard, and we haven't thought through our new requirements under PPACA with filing ATNI reports and MLR and everything else that's new to us. But just off the top of my head, most of those are tied to group size.
Yes, I don't think we can go without the group set up.
Right. So as we stated earlier, we have carriers today that we work with under this practice, and what we provide to them is the information necessary for that type of reporting, and it seems to work fine. So, yeah.
Sorry to interrupt. I don't see how you're providing all this information when those rules haven't been defined yet for PPACA compliance in 2014. So what am I missing?
Yeah, so given the new direction that the feds are taking, it makes sense then that they're going to set up separate groups because their FFEs are single group based now. And so our intention was to follow the FFE technical guidelines so that national carriers can have one standard to adhere to. We would still like to do that. Obviously, we don't have the documentation that the feds have provided for that group transmission of data. And as soon as we get that, then we probably should adopt that here. But again, we haven't seen it yet. And that wasn't the direction we were going. It wasn't the direction the feds were going until about a month and a half ago. So it's obviously something that we have to look at. Again, I think that a lot of the rules that are out there are old and outdated for exchange setups, and so if it makes sense to propose to the feds to say, hey, make this go away, then make this reporting requirement go away, then let's go that direction. But we need your input, so we need to know from each of you that are concerned about this, what are the rules that are required to be reported to the feds as groups, or what things. What processes in your system don't really work well with the New World Orders come January 2014. I think in the interim, while we try and figure that out, we're going to have to adopt, and until the feds decide you don't have to do those reporting requirements, we have to continue to assume that we will have to do those requirements. So we will have to adopt a methodology to provide you with the group information. Again, it makes sense to adopt the FFE technical requirements so that there's one standard to implement. We will get that to you as soon as we receive it.
And John, how was the premium going to come in? Originally, I thought it would come in by the employer group. So we'd get one payment for the employer group and then the 820 to reconcile the employees within that group. Is that different?
So we can talk a little bit more about that next week, but specifically you will receive a membership record and the premium that was received for that member. So it's reported at a member level in terms of we receive the premium for these members or not.
Not at a group level.
So you'll get one electronic funds transfer each night, and then the 834, 820 files that go with that, or I don't know if there'll be 834s with everyone, but there'll be 820 files with that payment that will indicate who that payment is for.
Yeah.
So the amount on the 820 file should match the amount of the payment.
Correct. Yep. And the 820s, there's a question about it later, but the 820s, we talked about it last week, they are net of additions, subtractions, retro adds, retro terms. It's a net premium remittance, and the supporting detail for all of the members is providing that 820. It's not done on a per group basis. It's net of the membership
But if we go down the road of it being a separate group, would you then send your premium by group instead of?
It's always going to be done at the membership level.
That's a big change for the carrier because right now all the billing, reconciliation, and all reporting is done by the group at the group level, and this is a huge change.
So you want us to send? You want us to send 1,000?
Quite unexpected.
You want us to send 1,000 EFT transfers to you every day?
Well, that's a computer. We don't care.
But there's costs associated with each EFT. So, and I think you're going to find across the country that this is going to happen in lump sum every night.
Yeah, I mean, one of the key differences that you called out there is historically the issuers have been responsible for AR management, aging, collections, membership management. All of those functionalities are being managed by the exchange. Really what you know is your membership, nothing else.
And we currently work with Anthem in California right now under this premise. So if you have any relationship to their systems or their processes, maybe they can share that with you.
But again, you know, we're talking about SHOP here, and across the country, this is the way it's going to end up being done, because you're going to have hundreds, thousands of employers in a SHOP exchange. Well, we can hope for thousands of employers in a SHOP exchange, and providing multiple EFTs again is a costly endeavor long term.
Okay. Since we've started kind of talking a little bit about the membership management piece, I think this is a natural transition for us to move on to slides 12 and 13, being the membership management. Membership management, slide 13, is specifically deals with group changes, employer information, address, contact name, etc., as well as member changes, special enrollment and life events, consumer request determinations, and tribal member changes. So we provided a high-level flow on slide 14 regarding the membership management overview. We've talked a little bit about this in the last couple minutes, but any questions specifically in regards to the flow presented on slide 14? All right, there's just a couple things that I do want to highlight out here, and one of them is in regards specifically to the employer role in this process, in that the employer is the gatekeeper and the approver of the requests that come in from the employees. We are looking for them, since they're the ones that are attesting to the information, to validate life events and things of that nature, and request appropriate documentation from their employees to approve that request. Once that request is approved by the employer is when it is transmitted to the exchange and then ultimately to the issuer.
I find that interesting because today in small group, none of our employers request that information. They have the carrier do that. So if the employer is just pushing it through,
and the
verifying that,
the employer can push it through. Ultimately, they're the ones attesting to their membership and their employees and their dependents. They have a vested interest, if they're adding a dependent from a cost standpoint, to validate that as they're required from a contribution standpoint to participate in that.
What's the consequence if an employer doesn't do it? And in other words, they just submit their neighbor or somebody else, or a child that's not actually a child of one of their employees, or somebody who's not actually married, but they say they're married. What's the consequence to the employer?
Right now, the employer is attesting the information.
So the consequence is?
Well, so if
fraud.
So yeah, well, it's insurance fraud. First of all, but if that does happen, the consequence would be, if we determine that person not to be eligible based on information received, then we would have to terminate the coverage.
You terminate the coverage retroactive to the original date, even if it was 4 years ago?
No, we would have to terminate it. No, this hasn't been decided, but I would say that we would terminate it go forward.
So really, there's no consequence to the employer?
Insurance fraud, then that's the consequence.
Yeah, I mean,
what's the consequence of insurance fraud on this case because the employer is not an insurer?
So let's back up here. So what you're saying is that the carrier verifies all membership in the small group market at this point?
Yes, because we take on the risk of paying claims
and
covering
so
people that we have an interest in making sure that person really is eligible.
And so that verification
doesn't have that interest.
That verification process includes looking at marriage certificates or birth certificates, et cetera?
Yes, absolutely.
At initial enrollment?
Absolutely, and throughout the year. So if somebody tries to add a dependent that doesn't match a last name or otherwise, yes, that information is always required.
So from a new group enrollment perspective, for each employee that enrolls, you would request birth certificates for all the dependents and proof of marriage and enrollment?
Sure, there's rules. So if, for example, I tried to add 14 children and each one had a different last name, the carrier's not just going to say, oh, that's fine. It was done during initial onboarding.
What if they all have the same last name?
You might be looking at, I'm sorry, you might also be looking for CUNESCOs and other court orders, et cetera.
Absolutely.
Now, so you said if they all have different last names. If they all have the same last name, you look for the birth certificate still?
No.
Yeah. So again, I think the way that the ACA is looking at that is the employer is the one who is attesting to the information. They have a vested interest from a premium contribution standpoint that they're paying at least 50% of the cost.
I can tell you, just because I have that area in our company, on a daily basis, the employer groups are sending over people who are not eligible.
All right, Well, all right. So we'll take another look at this first of all. But there's one.
The general message from our end is this is a significant risk.
Okay.
That, we haven't spent much time thinking about on our end, and so this is good. We're having this discussion.
Well, and again, we're having these discussions so that we can form our policy as well. It doesn't mean that we are set on a specific policy. Now, one of the new things about the new rules is if they don't get it on the shop side, they can still get coverage on the individual side. My guess is if you're an employee, you don't want to put your dependents on your coverage on the shop exchange. If your employer doesn't provide a subsidy, you want to get them on APTC. Now, for children, they have to go on the shop side. They are required. Employers are required to offer it. And if a dependent has coverage or is eligible for coverage, they cannot go to the individual side and not get eligibility for the APTC. In the future, though, if you're talking about adding 10 dependents that are not really dependents, those dependents are going to want to go to the individual side so they can get APTC. So, I think we all need to we'll take another look at this. But I think we need to look at this not in the lens of what happens today, but what is going to happen in 2014 when people are eligible for the APTC on the individual side. My guess, you will not see extra dependents on shop coverage if that employer does not pay for a portion. Now, if they're paying for a portion, that mitigates some of the risk, I would think. If they're not paying for it, again, they're going to go to the individual side and get APTC where they can. So let us go back and look at it. Let's re-look at this discussion next week, and you guys think about it from an actuarial perspective. Does this really add risk in the new world, in the new market, or is this something that is it's something from today? It's a carryover from today. If you guys can look at it, we'll look at it. We'll come back and have another discussion next week about it. Does that work for everybody?
Okay.
Yeah, that sounds great.
All right. Moving on to slide 15, I'm not going to run through all these in detail. It's kind of a standard section that we have in each of the onboarding sessions, which are what are the special enrollment periods for SHOP, the time frame around it, and the effective date rules that are used to manage that. Are there, as CJ called out, the tribal special enrollment, if it does follow the special enrollment rules 1st through 15th, first of the subsequent month, 16th through 31st, 2 months out, roughly. Any questions about the special enrollments for slides 15 or 16 for SHOP? All right. Any questions just in general in regards to membership management on the SHOP side before we move into the financial management aspects for SHOP? Okay. Hearing none, then I'm going to have Steve Huynh jump in and talk a little bit about the financial management section for the SHOP marketplace.
Okay, good morning, everyone. The financial management section will cover, just as we did last week, the first slide is on page 18, payment methods. So there was actually an error on that slide. It should have said for SHOP, payment methods for SHOP. They are the same as payment methods for individual. The employer can pay through ACH or credit card through the portal. They can also pay through the contact center by calling in. They can also pay through check like they normally do today, and then at the state designated locations. Okay. So if we move on to slide 19, what we wanted to cover here briefly is the rating rules. During the individual presentation, we only covered the individual rating aspect of the rating rules. We wanted to include additional topics that are applicable to both the individual and SHOP in regards to tobacco in the rating area. So the individual rating rule applies here just as it did under the individual exchange. Each family member is individually rated. Max level is 3 kids under 21. Some of the individual rates will equal the household rate.
And one of the key things to keep in mind is that in the SHOP, the household will be enrolled in the same plan from same QHP from a given issuer. All members will be enrolled in the same QHP plan.
Correct. And then in regards to tobacco use, we didn't cover it last time, but it is so there would be a question for each household member, yes or no for tobacco use. The rating factor is a maximum 1.5 to 1, and only for those that are using tobacco that are 18 and older. Okay. John discussed the rating areas earlier in the presentation, and so those rating areas that were submitted by Nevada applies. Any questions on that slide? Okay, let's get into the workflow presentation on slide 20. This is very similar to the presentation from the individual side in that there's a same process concept as far as managing the finances, the delinquencies, and the payments. So are there any questions in particular to this process?
Will you be sending partial payments or just if they've paid in full?
So the requirement is 100% payment in full as billed.
Right. So we will so since that is the requirement, we will be only sending a payment when it's paid in full. The reason for that is because you could have multiple QHPs being paid from an employer, and so in order to determine who to be paid, we need the payment in full in order to distribute the premiums appropriately to each QHP. Any other questions in regards to this slide and how the process has been determined here?
How about retroactivity?
Can you elaborate on that question, please?
Well, if let's say, add member retroactively 1 month ago and you have to generate adjustment or whatever, how is that going to be processed?
So,
they already paid for the previous month, for the previous month. They are in the next month, and then they added the spouse retroactively, for example. How is that going to be processed?
Okay, so that will be processed based on the data receipt. Once that adjustment is processed, it'll be billed to the next employer's invoice. And so if that's processed on say the 5th and we are invoicing on the 10th, that adjustment will appear and be due with that invoice. So once that payment is made, that adjustment will be dispersed out to each of the QHPs.
So you will send the new 834, and then later on, the amount will be added to the 820 next bill paid.
Correct. We are currently yes, that is currently the process that has been defined. We are currently discussing additions of dependents and changes, and whether or not to require payment at the time of the enrollment. So that discussion is currently being had internally, and we'll let you know the outcome of that.
And how do you process refunds if they cancel, like 1 month ago retroactively? So how do you take money back from each year from carrier? How is that going to happen?
So once the termination is processed, an 834 will be submitted for that termination with the appropriate termination effective date. And if there is a refund due because of a payment made and dispersed to the carrier, then that will be reported in the 820 via a negative transaction amount, pulling that money back, and then a refund will be issued accordingly based on the rule for refunds in regards to the payment type. Based on the payment type received, we will send out refunds to the employer.
So if the whole group cancels, then you will do that for every member separately. You will send the termination 834 for each member and 820 taking money back for each member as well. Right?
That's correct. We have a question in-house.
Yeah. So on SHOP and actually individual from last week, the question I have in reading through the boxes, and forget the ATC side. When I read this, it looks like, so for February, if they don't make the February payment, whether you're on the individual or the SHOP, they get 1 month of coverage for free? Because we're terming them at the end of February, but they didn't pay February.
Right. So the coverage will be termed prospectively, and I believe that was based on state regulations as far as notification needing to be made and a grace period needing to be provided.
So you don't retro them back to the last payment.
How do you handle that today?
We retro them back to the last payment.
How do you get around with notification and prior notification of termination?
We give them the notification like you're doing. We give them a 10-day notification in their 30-day grace period if they haven't paid. And then at the end of the 30-day grace period, if they haven't paid, they are retro terminated back to the last payment. So the carrier is not responsible for all the, the loss of premium and the paying the claims. Because if they were terminated at the end of February, we would be at risk for their claims. And we wouldn't have received premium.
Correct.
So we retro that back. And I meant to ask that last week when I was reading through this, so in this scenario, we're giving them the whole group a whole full month of premium.
Right. So
free.
Yeah. So based on our understanding of of the regs. That was the proposal. So since John stepped out, we'll go ahead and take that back and have that discussion.
That's on both of these slides for me.
Yep.
Okay.
Yeah, that is the current workflow as proposed. Okay.
Any other questions in regards to the financial management payment process, delinquency notices?
Will there be an 820 record for each member in the group? Payment record?
Yes, the 820 will include a payment record for each member.
And it'll add up to the full group billing amount?
Not necessarily. It will add up to the membership for which the QHP is responsible for.
Well, right, okay. And that'll include both the employee and the employer responsibility portion?
It would include the total premium due for that member's coverage.
Okay, thank you.
Hello, this is Adrian. So on slide 16, loss of Medicaid is typically a 60-day time frame per federal reg. Is Nevada deviating and just doing the 30-day?
So
we'll take another look at it.
Thank you.
Okay. Any questions on the financial management side before we move into renewals?
Are you going to take care of no premium for newborn for 30 days requirement?
What do you mean, are we going to take care of it?
There is a requirement in the States that no premium should be charged for the newborn for the first 30 days.
Okay.
Are you taking care of that?
You mean, are we changing state law? So we are not. We have not submitted a bill draft to change that law. Now, the Assembly Bill 425 from the Division of Insurance, the omnibus bill, makes a whole lot of changes to Title 57, and there's a whole half a page list of the statute sections that are going to be repealed. I don't know if that's in that, but my understanding, I was not aware of that it was. So, we could take another look at that. We will get with the DOI to confirm whether or not that is being repealed or not. But my understanding as it is right now, a carrier is required to provide coverage for a child for the first 30 or 31 days of life. That if the coverage is going to continue beyond that, they have to actually elect coverage. Now, the way we've interpreted it for our enrollment eligibility, if a child is born on July 5th, then the parent doesn't get a free premium for that person all the way through August 5th. They have to start paying August 1st, so that the premium, APTC, for the individual side, on the shop side, the subsidy amount would all start on August 1st, so it's on the first of the month following the birth. Coverage, again, would begin on the date of birth. Payment and APTC, CSR would all begin on the first of the following month. And I think that's the way that the federal regs read. And so I don't know if it's necessary to change the state law based on the current federal regulations.
You are talking APTC for individual, not for the small group, right?
Yes, I apologize. I kind of mixed the individual and shop side. Yes, so on the individual side, APTC, CSR, premium payment all begins on the first of the month following the birth. On the shop side, the employer contribution, if applicable to, if they provide contributions for dependents, that would apply beginning the first of the month following the birth. If they don't, then the entire amount of the additional increase in premium due to the coverage of that child would begin on the first of the following month as well. So for bill purposes, it begins on the first of the month following the date of birth. For coverage purposes, it begins on the first or on the date of birth, or adoption or placement for adoption.
Okay. One item that the exchange indicated during the last session that we would take back and review, both on the individual and the shop side, is the reference to the plus 5 days on the notification. We have removed that on a go-forward basis, and we'll be updating the presentation accordingly. Okay. I'm going to go ahead and move on to the renewal section. So we are on to slide 22. So for renewals, the exchange will send renewal information to the employer approximately 90 days prior to their plan year end. We say approximately for processing time and calendar days and months and where those all fall in, but it's going to be approximately 90 days prior. From that, the employer will have 30 days to submit changes to their purchasing model and or any changes to their contribution scenarios that they have elected. Once the employer has completed that step, the employees will have 30 days to submit any renewal changes during that open enrollment period for the employees. If the employee does not submit changes, the employee's plan will auto-renew, assuming that it is available in the current purchasing model elected by the employer. If it is not, or is no longer available, then the employee will need to make a new plan selection.
And if they don't, then do you cancel them, terminate?
If they do not make an election, it would be assumed waive coverage.
Well, that sounds risky.
I can tell you this is still an area where the exchanges would like to solicit some feedback from the issuers in regards to how to best manage potentially the migration of members from plans. It makes sense, and it's a little more straightforward when it's one QHP one issuer within their plan portfolio. But if a QHP that an employee is enrolled on is no longer offered in that purchasing model, there's a question outstanding whether or not the exchange has the authority to auto-enroll an individual into a QHP which they have not elected. And we don't believe that authority exists, and as such, we have to treat it as a waived coverage, although we're open to suggestions, comments in regards to that process. Any questions on the renewal section before we jump into kind of the open Q&A and answer some of the questions submitted by the various issuers? Okay. All right.
Can we hop back to a question on slide 6? Can a new employee's effective date be first of the month following a 90-day waiting period? A pending federal reg seems to indicate that the effective date cannot exceed 90 days.
That is correct. It cannot exceed 90 days.
Okay, thank you.
So just to follow up on that, the 90-day waiting period ends, say, July 10th. Coverage needs to begin effective July 10th.
July 1st.
So coverage would start July 1st.
I got you. Okay, thank you.
So the end of the 90 days is July 10th. What if it's July 20th? Are you going to do July 1 or it would have to be July?
It all have to be July 1st.
Yes, correct. In which case the employer would be responsible as well as the employee for their portion of the premium.
July 31st is tough.
Yeah. Okay. As I mentioned before, there was one a change based upon some discussions with the exchange in regards to the plus 5 days. That has been removed from both the individual and shop delinquency and notification workflow. In addition, one other clerical correction to slide 20 refers to the individual is termed for non-payment. That's actually the employer being termed for non-payment. Again, that's an artifact of the fact that we're managing both shop and individual delinquencies and flows very similar. All right, we had some questions that we mentioned a little bit earlier, specifically around primary work site. What if someone works from their home? How do you determine eligibility for various service areas, things of that nature? So if the question specifically said an employer must have their principal business area in the service area of I'm going to read the question here. Employer must have its principal business address in the service area or an employee's primary work site in the service area. How will the exchange determine each employee's primary work site? So both the employer or the employee is attesting their physical location. So again, it's determination by the employer that this is their physical location, and for the employees, if they are using work site, this is my physical work site location. If an employee works from home, what is that employee's primary work site? It's their physical home address. That's their primary work site. Question that came up was asked, I think it was asked in the room a little bit and on the phone, what if we have an individual who works from their home in Reno and the employer is a Las Vegas-based employer? What is the employer's primary work site? How is that rated for service area, etc.? The exchange's desire is to handle scenarios like this through the plan packages. However, the employer must choose whether they are going to cover their employees based upon principal business address location or work site location. So depending on that employer's determination will determine how that employee is rated, whether it's their work site location or it is the employer's physical location.
And I think in an earlier meeting, you did that if there was a pattern of claims outside of the primary work site, that we would have an appeals process to come to the over that.
Yeah, there was a question in regards to that, which, so if the issuer does see a pattern of claims, there was a question specifically, what if we see a bunch of claims from Texas or another state? The issuer can appeal that eligibility decision to the exchange, provide the supporting documentation, to appeal that eligibility determination. All right. Moving on to, there's some questions in regards to determination of minimum number of hours worked and documentation required, as well as whether an employee is an actual employee. The general answer that we're providing is that it is attested to the employer. However, based upon the conversations today, that's something that we've asked both the issuers and the exchange to go back and look at that documentation process around certain eligibility requirements, specifically around dependents. In terms of if someone is an employee or if they've worked the minimum number of hours, that is, the employer is going to attest that on its face, unless we determine that there's an inconsistency, which we addressed previously, in which case the exchange will work to resolve that inconsistency with the employer and the employee to provide a determination of eligibility if we are aware of inconsistencies in that information. Usually that's going to come from an employee appeal of some kind saying that they should be covered and their employer is refusing to cover them. There was a question regarding cost share reduction eligibility for tribal, and to reiterate the point that CJ made earlier, cost share reduction is not applicable for tribal members in SHOP. Slide 13 asks that they can change the tribal members can also change the QHP once a month. That is correct, following the special enrollment window rules, which we talked about a little bit earlier. There was a question clarifying some of the packages in regards to the open metal tier, whether any plans offered in any QHPs in a given metal tier would be required to be offered in that open metal tier, or if the open metal tier requirement only applied to silver. The answer is any QHPs in a given tier must be offered in that open tier option. So whether it's bronze, silver, gold, platinum, if that's the purchasing model elected by the employer, all QHPs with that metal designation must be offered or will be offered to the employees for enrollment. There were some questions specifically in regards to payment methods around credit cards for SHOP. There was a concern if, in regards to cost of payment processing, that is an area that the exchange is still evaluating to determine the best approach to offer the flexibility and convenience of credit card payments with the cost associated with that and how that could best be handled. So
we're discussing that at tomorrow afternoon's board meeting.
So there you go.
It's one of their agenda items is credit card fees and how they will apply to the exchange. Yep. And if they will be applied back to individuals, carriers, or absorbed by the exchange, or not even accepted as a payment method to the exchange. So that'll be discussed at tomorrow's board meeting. Tune in.
Exciting stuff. All right. On slide 18, this was one of the corrections that Steve pointed out. It's not individual payment, it's a SHOP payment. The payment premium is always collected from the employer. There is no premiums collected from the individuals. The employee cost would be recouped by the employer through payroll deduction or similar method, and a single invoice paid by the employer, not by the individual covered members. Okay. There's a question in regards to, on slide 19, referring to rating, including age. And the question is, if a group elects coverage start date of April 1st, and someone has a birthday in the middle of June, when does the rate increase? For the purposes of age determination, the age is calculated as of the effective date of the addition to the policy. So in this case, the age would be determined as of June for that individual, because that is when the effective date of their coverage is. And the rate would remain unchanged then through the rest of the plan year. There were a couple questions I think we alluded to a little bit earlier in regards to what visibility the issuer would have in terms of claims disputes. You've got a large claim incurred out of the service area, or a pattern of claims outside of the service area. And as I mentioned earlier, there will be a process discussed where the issuer will be able to appeal that eligibility, provide supporting documentation, and the exchange will make the determination in regards to the eligibility of that individual as appropriate. Question in regards to if an employee changes their mailing address to an out-of-state address, or the exchange becomes aware of it through a USPS update, will the exchange terminate coverage? The answer is no. A change in mailing address does not constitute a change in eligibility, so we would not terminate coverage based upon a change of a mailing address. Couple other questions here in regards to invoice payment. I think we covered both of these during the presentation, but what happens if an employer short pays by a penny, or if they dispute or if they go to an invoice and short pay an invoice because they believe they had a retroactive termination that they shouldn't have to pay for? The requirement of the exchange is not only to pay in full, but also pay as billed. And that's for the reasons that Steve mentioned earlier. When you're doing premium aggregation and disbursement to the issuers, we can't pick favorites. We have to pay what is owed for the invoices and the coverage that is expected by the issuer. Any adjustments would be reflected on future invoices and subsequent 820s from a premium reconciliation standpoint. All right. There was a question. This kind of gets into one of the nuances, so I'll try and answer this the best I can. And it's an assumed question, so we're going to go with a hypothetical question. We'll go with the hypothetical answer the best we can here, which is, assume an employee moves from Las Vegas to Reno, which results in different rates, and they fail to notify the exchange for 6 months. And then the employer-employee comes to the exchange and requests that that change be made retroactively back to the date of the move. What's going to happen? So the request would be denied because it fell outside of the required reporting timeframes. The employee's address would be changed, and the new rate applied as of the first of the following month no special enrollment period would be granted because that employee fell outside of that time frame. Again, this is one of those areas where you as an issuer all of a sudden see a history of claims in Southern Nevada, all of a sudden it shifts up to Northern Nevada. You have an opportunity to appeal that eligibility and go back and do a redetermination or have the exchange determine eligibility on that individual. But that would be the process as defined right now for that given scenario. Okay. Just a couple more questions. Specifically around billing activity and retroactivity. If an employer's effective date is hypothetically January 1st of each year, and in January of 2015, an employer adds a child or other insured that affects the premium retroactively back to December as well as January. So we have a bill splitting plan years and not only plan years but also premium months. Will the exchange bill and collect for the 2014 rates for December and the 2015 rates for January? The answer, and aggregate and bill appropriately. The answer is yes. We will bill the appropriate premium for the December 2014 rate, the appropriate rate for the January, aggregate and remit to the issuer as appropriate for the payments. Is there a question there? Okay. Question in regards to receivables management, specifically around payments and receivables on the individual exchange, reconciliation of employer accounts. How is that handled through retroactivity, family structure changes, etc.? We're going to be providing specific additional details in next week's session. I believe the presentation for that will be posted, if not later today, first thing tomorrow, but I believe it'll be up later today, which will walk through a lot of the flows around reconciliation, the processes for reconciliation, and the details around that as we go through the life cycle of a group and add terms, etc. There's a couple questions in regards to how will differences be resolved between a carrier's calculated receivable and the exchange's receivable, as well as what type of insight will the issuers have into the exchange's financial management systems, reconciliation, premium, receivables at the member, the group level. This is kind of the conversation that we started getting into a little bit earlier today. The exchange is the enrollment and billing system of record. And as such, the issuers, if you are maintaining receivables on your systems, would need to be reconciled to the exchange's member management system. We'll talk about that a little bit more in next week's session from that process. But the general concept here is that the issuers ultimately will not be maintaining receivables, will not be maintaining anything other than membership and eligibility to pay claims. The exchange is managing everything else around that process and transmitting payments and membership information and member rosters to the issuers for coverage.
Will that be a one-way reconciliation process for membership, and who would be responsible, the carrier or the exchange, for doing the discrepancy, compare matching, and all that?
So the exchange is the membership system of record and will provide the appropriate files for the issuer to reconcile against. The issuer can then provide a reconciliation report back to the exchange detailing any discrepancies that are found in their membership system against what the exchange is holding as membership system of record. We will cover that more significantly in next week's session, specifically regarding reconciliation.
Okay, just a quick note before we leave that topic that the FFD is proposing the opposite, where they're driving the whole compare process and resolution, where we provide a monthly file to them. So we can talk about that next week.
Yes. Okay.
What about confirmations?
Say again?
Is there a requirement for carriers to send in confirmations after the successful enrollments?
So there is not, are we doing an inbound 834? I don't think so. No, we're not doing an inbound 834 for effectuation of coverage from the issuer because exchange is holding the membership of record. So the issuer is not effectuating coverage back to the exchange because the exchange is handling billing, premium aggregation, and remittance. The issuers do not need to acknowledge the enrollment back to the exchange.
The only acknowledgement that, and we'll talk about it again next week, is the 999 acknowledgement file, and potentially, if the carrier wants to submit the TA1.
The TA1 is simply an acknowledgement of receipt of the file, that you actually received the EDI file, as opposed to the 999, which is more detailed level information about the response to the EDI file.
And would you want it only upon a success, or would it be both success as well as failures?
So
the TA1
yeah.
and
Yes, we would look for both success and failures.
Okay.
And we'll discuss it in a little bit more detail, and we're going to try to have a couple of our EDI folks on the line to have that discussion next week.
Yeah, just to note, the FFE requires an 834 confirmation for all enrollment changes, and a lot of that ties back to the ownership of the reconciliation function, where they own it. They want to know about the daily transactions to tie them up.
Right, but also in the FFE model, they're not handling the billing and notices and other parts that have been passed on to the issuer. So the Nevada model is different, and as such, there are different processes around that.
Okay.
All right, we've got.
One last thing.
Yeah, I was going to.
We're still pretty confused about how the broker information is going to come across. Is that going to be covered next week?
We can specifically cover that. The broker information is communicated in the 834.
Yeah, I believe that.
It looked like there were 3 or 4 different areas where it might be hiding, and
so
we'd like to know where to look.
So if you're asking the specific loop and the details, we'll have that answer prepared for next week.
Great, thanks. Give me a reason to come back.
We're right by Starbucks. You should come anyway.
So I was going to open it up for any other questions, general questions in regards to this, or prior sessions if there's any burning questions out there. As always, go ahead.
Okay, this is Adrienne from Anthem. Okay, in the QHP issuer onboarding document for individuals, you talked about dental, if offered, must be offered as a rider or standalone product. What we wanted to specifically ask related to that presentation, is the standalone dental requirement applicable to pediatric dental, or do we need to embed pediatric dental? And is this the same for shop and individual?
Well, for the individual side, if QHP does not offer a standalone dental product or offers a pediatric standalone dental product, then we are allowing standalone dental products to be offered as separate QHPs. We are not allowing it to be embedded. It has to be placed as a rider, so we can separate out all the various functions of that dental plan for shop and comparison and transparency reasons, as well as having separate premiums, which my understanding is you guys were doing separate premiums before anyway, but this also shows a little more transparency. It was presented to the board as multiple options, and the board had approved that it would be done solely as a rider and not embedded into a qualified health plan on the individual side. As far as on the shop side, I have to look at a few other issues. I'm also going to look at the participation requirements as well. So if you'll just give me a little bit of time, I will find out what the requirements are for the shop side as well. But I believe, I may have to come back and restate this later or correct myself. I believe we're going to utilize the same process for the shop, that it also be offered as a rider, but I'm not 100% sure, so don't hold me to it.
Okay, wonderful. Thank you so much. Okay, another question. Provider directory. What session do you see us talking more about provider directory and the layout for that?
So in one of our previous sessions, we indicated that we would have a file layout available in April for the middle or so of April for the additional data that we're requesting the issuers to submit. Just because of timing and where we think it's going to best fit, we will make that template available with the May 1st certification and network adequacy material. So it'll be posted roughly a week prior to that meeting, and it would be our intent to address any questions in regards to that template or the data elements that are being requested during that May 1st session.
Okay, wonderful. And so that is that May 1st session also when we'll get the 820 layout?
I believe we're trying to have all of that ready and available prior to next week's session.
Okay. And then which session will cover all the fees and how those will be handled?
Which fees are you specifically talking about? The per member per month fees? Or are you talking about the potential for credit card fees? Which fees specifically?
The exchange fees specifically.
We have already adopted fees for calendar year 2014 at our January board meeting. $4.95 per member per month for a qualified health plan, and an additional 36 cents for standalone dental. Or if dental is part of that qualified health plan, so it turns out to be $5.31. We will not be adopting new fees until I would imagine next January for the calendar year 2015, but those are the adopted fees as of today.
Okay, so I think we know what the fees are, but I don't think we know how those fees will be
collected,
embedded or not embedded, or so on and so forth. Do we have the Anthem person on the phone that had questions about fees? Okay, well, John, I'll get back with you a little bit more about what we're specifically.
Sorry, I should have introduced myself. I'm Damon Haycock with the Exchange as the Finance and Research Officer. I don't want to misrepresent John. He talks a lot better than I do.
I'm sorry.
Let us do this. We'll take that back and determine if there's an appropriate onboarding session that we can encapsulate that in, or if necessary, schedule an additional session to handle that and any other identified items as a kind of a catch-all if necessary.
And also at any point.
I from a carrier perspective, we know that price is going to be the driver, and so if we have some people that embed those fees versus being separate, it's going to portray that cost differently to the member, and we just want to make certain that we're doing it all in a consistent way. Okay, so I have a question. Do you have any initial thoughts about filing multiple rates due to the federal restriction that won't allow us to file more than once annually until the system is updated? And this is related, John, to that document I sent you over this morning.
Unfortunately, John had to step out of this meeting, so I'm not going to speak on his behalf except with the patent answer that we'll get back to you because I haven't seen what you sent him this morning.
So are you asking about such as applying a trend factor, like a quarterly trend factor to rates or something, or maybe you could explain it? Okay.
Because there was an update in FFE guidance that just came out on Monday on that. And so I did mail that information to John, and if I need to send it to you, we certainly can.
Yeah, I know we've had some discussions with the DOI in regards to that. I would say it's probably still an open item at this point in time.
Okay, awesome.
We
had, it sounds like somebody else mentioned when we're going to have a broker session, and we specifically have a lot of questions about the integration with website and broker flows and how will agents, brokers interact. And so I can send over some of our questions that we're looking to evaluate whenever this broker session occurs.
Okay. Perfect. So, yeah, and one of the things that I wanted to call out is that right now we are in the process of establishing an inbox for issuers to submit questions. Once that inbox is established, we'll go ahead and publish it, and I'm sure it'll be distributed out via the listserv as well for issuers to submit questions. One of the items that the Xerox Choice team has taken on is after these sessions, we've been providing and posting answers to the Q&A. We have begun consolidating, and I believe we're just about ready to post a consolidated Q&A, which we will be regularly updating and will be the official communication response back for questions submitted to that issuer inbox. So that as questions come in, the exchange can proactively communicate answers back out to the issuers without having to wait for a specific onboarding session. So feel free once you get notification of that. I know John has given his email address in the past. If you have specific questions in regards to that, I think Damon also gave his email out today. If you've got burning questions you need to get answered, get them into them, and so we can start looking at them. But we'd look to have you start submitting questions as they arise to that carrier inbox so that we can start getting responses out to you as quickly and as efficiently as possible.
I know on our website right now we have those links on the carrier onboarding page under resources that have the 3 question and answers links to the questions and answers that we've already begun answering. And I know there's some lag in asking those questions and getting those answers, which is why Xerox and Choice are developing that inbox. So we do apologize that there is that lag, but it also gives us a little bit of time to develop answers as well.
Okay, and one more question. This is Adrian, and I promise I'll stop for today, or you can charge me per question. But when I look at the Q&A that's out on the website, the last one that I see listed is March 13th. There's an A and a B. And last week in this session, you reviewed some additional answers, and they were good answers, but we never saw those posted. So will you be posting all those, or do we have to wait until we get this new thing that's built?
So as a result of all of the questions and tracking and which version are you looking at, that's why we've created this consolidated questions. The answers to that session will be posted as part of that consolidated Q&A. It's our intent to get that posted no later than Friday. It may be sooner. We just want to validate some of the answers and make sure that we're providing the appropriate answers to all of the issuers and try and answer them as completely as possible. So look for that no later than Friday of this week to be posted, that consolidated Q&A.
Okay, awesome. Thank you.
I have a quick question. Is a 834 companion guide published by the state?
It's the state's intent to use the federally facilitated exchanges 834 and 820 companion guides. However, as we have started to see deviations in the business processes from the FFE and the Nevada Exchange, specifically around premium aggregation and remittance, as well as in the purchasing model, we will be publishing a Nevada-specific 834 and 820, heavily reliant upon what is in the federally facilitated. We don't believe at this point in time there will be any changes to it, but we do want to put our own version out there in the event that we do have to make changes or the final companion guides from the feds do not permit the marketplace operations as Nevada has defined them for our launch in October as opposed to the Fed's launch in October. Did that answer the question?
Any ETA?
Steve, I know we've got...
The first draft should be available no later than next week.
Next week, then.
Yeah, first draft will be available no later than next week, and that's for both 834 and 820.
Thank you.
Okay. Just a quick recap here, the next upcoming sessions. Next week, the materials for that session will be posted later today. Is the reconciliation, reporting, and file transfers, and that will be the April 17th session, followed by appeals and appeals-like processes. May 1st will be the certifications, network adequacy, and the additional provider detail and the file review for provider details. May 8th, fulfillment, looking at ID cards, plan collateral, etc., messaging, notifications, those type of items. And May 15th is currently scheduled for customer service, public education, and as appropriate, if we identify a TBD that may need to be added to have additional items, then it would be scheduled probably the week after that. So we finished a few minutes early, so I want to thank everyone for joining today, both here in person in Carson City and on the phone. As always, if you have questions, feel free to submit those, and we will answer them the best we can. Thank you, everyone, for your time, and look forward to speaking with you next week.